Sleep is a vital aspect of our daily lives, and it plays a crucial role in keeping us healthy and functioning at our best. While many of us may think of sleep as a luxury or a downtime activity, it's actually a biological necessity that our bodies require for optimal health and well-being. In this video, we'll explore the science of sleep, what happens in our bodies and brains while we're asleep, how sleep patterns and habits can affect our overall health and well-being, and tips for improving the quality of our sleep. Did you know that humans spend approximately 1/3 of their lives asleep? That's a lot of time spent in a state of unconsciousness, but what exactly is happening in our bodies and brains while we're asleep? In this video, we'll dive deep into the science of sleep to understand why it's essential for good health and well-being. So, whether you're a night owl or an early bird, get ready to learn everything you need to know about sleep. The science of sleep. The two types of sleep, REM and non-REM. Sleep can be divided into two distinct categories, rapid eye movement, REM, sleep, and non-rapid eye movement, non-REM, sleep. REM sleep is characterized by rapid eye movements, increased brain activity, and vivid dreaming. Non-REM sleep, on the other hand, is characterized by slower brain activity and muscle relaxation, and it can be further divided into 4 stages. The 5 stages of sleep are as follows. Stage 1, this is the lightest stage of sleep, during which we're transitioning from wakefulness to sleep. Our brainwaves slow down, and our muscle activity decreases. Stage 2, in this stage, our brainwaves continue to slow down, and our heart rate and body temperature drop. We spend the majority of our sleep time in stage 2. Stage 3, this stage is sometimes called deep sleep or slow wave sleep. Our brainwaves slow down even further, and it's more difficult to awaken from this stage of sleep. Stage 4, this is the deepest stage of sleep, and it's the most difficult to awaken from. Our brainwaves are at their slowest, and our muscle activity is at its lowest. REM sleep, during this stage of sleep, our eyes move rapidly, and our brain activity increases. We typically have vivid dreams during REM sleep. The stages of sleep are not static, instead, they occur in a cycle that repeats throughout the night. Typically, the sleep cycle lasts approximately 90 minutes, and it consists of both REM and non-REM sleep. As the night progresses, the amount of time spent in REM sleep increases, while the amount of time spent in deep sleep decreases. This is why we may wake up feeling more refreshed and alert after a longer period of sleep. Our bodies have had more time to cycle through the different stages of sleep. Sleep patterns. Circadian rhythms are internal biological processes that regulate our sleep-wake cycle. They help us feel alert during the day and drowsy at night. These rhythms are influenced by external factors such as light and temperature. Disruptions to our circadian rhythms, such as those caused by shift work or travel across time zones, can affect our ability to fall asleep and stay asleep. Sleep hygiene refers to the habits and practices that can promote good quality sleep. These include things like sticking to a regular sleep schedule, creating a comfortable sleep environment, avoiding stimulants like caffeine and nicotine before bedtime, and establishing a relaxing bedtime routine. Practicing good sleep hygiene can help improve the quality of our sleep and make it easier to fall asleep and stay asleep. Sleep disorders can have a significant impact on the quality and quantity of our sleep. Insomnia is a common sleep disorder characterized by difficulty falling or staying asleep. Sleep apnea is a disorder in which breathing is repeatedly interrupted during sleep, leading to brief awakenings and poor sleep quality. Restless leg syndrome is a condition in which the legs feel uncomfortable and restless, making it difficult to fall asleep. Other common sleep disorders include narcolepsy and parasomnias such as sleepwalking and night terrors. These sleep disorders can have a variety of causes, including underlying medical conditions, lifestyle factors, and genetics. If you suspect that you have a sleep disorder, it's important to speak with a healthcare provider to get an accurate diagnosis and treatment recommendations. Benefits of sleep. Getting enough sleep is essential for our physical health. During sleep, our bodies repair and regenerate tissues, and our immune system produces cytokines, proteins that help fight off infections and inflammation. Research has also linked adequate sleep with a lower risk of cardiovascular disease, as well as better blood sugar control and a healthier body weight. In addition to physical health benefits, sleep is also important for our mental health. Adequate sleep has been linked with improved mood, decreased stress and anxiety, and a lower risk of depression. It's also essential for cognitive function. Getting enough sleep can improve our ability to concentrate, remember information, and learn new things. Sleep can have a significant impact on our productivity and performance. When we don't get enough sleep, we may feel groggy, have difficulty concentrating, and make more mistakes. This can affect our ability to perform well at work or school. On the other hand, getting enough sleep can help improve our productivity, creativity, and problem-solving skills. It can also help us feel more energized and alert throughout the day. Overall, the benefits of sleep are numerous and far-reaching. Prioritizing good sleep habits and making sure we're getting enough sleep each night can have a significant impact on our overall health and well-being. Consequences of sleep deprivation. Sleep deprivation can have a number of short-term effects on our physical and mental health. These may include irritability, mood swings, and difficulty concentrating. It can also affect our motor skills and reaction time, making it more difficult to perform everyday tasks such as driving. In addition to short-term effects, sleep deprivation can also have long-term consequences. Chronic sleep deprivation has been linked to an increased risk of a variety of health conditions, including diabetes, cardiovascular disease, and obesity. It's also been linked with an increased risk of mental health issues such as depression and anxiety. Sleep deprivation doesn't just affect individuals, it can also have a significant impact on society as a whole. Sleep-deprived individuals may be less productive at work, and they may miss more days due to illness. This can have a significant economic impact, as lost productivity due to sleep deprivation is estimated to cost billions of dollars each year. Overall, the consequences of sleep deprivation are significant and far-reaching. It's important to prioritize good sleep habits and make sure we're getting enough sleep each night in order to avoid these negative effects. If you're experiencing persistent sleep issues, it's important to speak with a healthcare provider to get an accurate diagnosis and treatment recommendations. Improving sleep quality. There are a number of things we can do to improve the quality of our sleep. Some tips for better sleep include establishing a regular sleep schedule, creating a comfortable sleep environment, avoiding stimulants like caffeine and nicotine before bedtime, and establishing a relaxing bedtime routine. Other tips include limiting daytime naps, getting regular exercise, and avoiding heavy meals and alcohol close to bedtime. In some cases, sleep aids or medications may be recommended to improve the quality of our sleep. These may include over-the-counter sleep aids such as melatonin, prescription sleep medications, or medications to treat underlying sleep disorders. It's important to use sleep aids and medications only under the guidance of a healthcare provider, as they can have side effects and may not be appropriate for everyone. In addition to tips and medication, sleep therapy and behavioral interventions can also be effective in improving sleep quality. These may include cognitive behavioral therapy for insomnia, CBTI, which focuses on changing negative thought patterns and behaviors related to sleep. Other interventions may include relaxation techniques, such as deep breathing and meditation, or sleep restriction therapy, which involves limiting the amount of time spent in bed in order to increase sleep efficiency. Overall, there are a variety of strategies and interventions that can be effective in improving the quality of our sleep. It's important to prioritize good sleep habits, and to speak with a healthcare provider if you're experiencing persistent sleep issues or if you're considering using sleep aids or medications. With the right strategies and support, it's possible to improve the quality of our sleep and enjoy the many benefits that come with good sleep hygiene. Conclusion: in this video, we've covered a lot of ground on the science of sleep. We've discussed the different stages of sleep, the impact of sleep on our physical and mental health, the consequences of sleep deprivation, and tips for improving the quality of our sleep. It's clear that sleep is a vital aspect of our overall health and well-being. Getting enough good quality sleep can have a positive impact on everything from our immune system function to our productivity and performance. If you're not getting enough good quality sleep, it's never too late to make a change. Consider trying some of the tips we've discussed in this video, such as establishing a regular sleep schedule, creating a comfortable sleep environment, and avoiding stimulants before bedtime. And if you're experiencing persistent sleep issues, don't hesitate to speak with a healthcare provider to get an accurate diagnosis and treatment recommendations. Remember, good sleep is essential for good health and well-being. By prioritizing our sleep habits, we can enjoy the many benefits that come with getting enough restful sleep each night. Thanks for watching.